Hello, everyone. Welcome to the Becker's Health IT and Digital Health Spotlight. I'm Laura Dierda, Vice President, Editor-in-Chief at Becker's Healthcare. And I'm really excited today to be speaking with Eric Smith, who's the Senior Vice President and Chief Digital Officer at Memorial Hermann Health System. Eric, thank you so much for being here.
Thanks, Laura. Looking forward to the conversation today.
Absolutely. And I'm excited to speak with you as well. I know Memorial Hermann is doing so many cool things and a lot of innovation, a lot of technology, but also just, looking at how you're able to work with teams and provide patient care. And so this is going to be a lot of a great conversation. But before we dive in, can you tell us a little bit more about yourself, your background, as well as what you do at Memorial Hermann?
Sure. So as you mentioned in the intro, I'm the Chief Digital Officer for the system. So with in that regard, I've got responsibility for our patient engagement platforms, messaging, patient portal, et cetera. I've got our data analytics, clinical informatics groups, data science groups, as well as our contact center strategy, looking at how we engage with patients when they need to call into our different contact centers to make sure that experience is a positive and consistent one across the board.
That's amazing to hear. A huge accountability. So let's dive right in. Can you tell me about the most successful project or initiative from the last year? What did you do and what were the
Yeah, kind of hard to nail that down. Obviously, we've been very focused on our Epic transition over the past couple of years, so that was a big one for us. But I would say if I reflect back over the past year, we've really tried to hone in and refine our omni-channel digital engagement strategy with our patients. We felt like that's really a critical component to being able to scale our ability to engage and reach patients. And so, as part of that, obviously, our transition to Epic and our introduction to MyChart and the app that we built on top of MyChart that we call My Memorial Hermann, we released, and we've seen incredible engagement and activations from patients. We're roughly at about a 50% activation rate for patients who come visit us. But probably more importantly, we're seeing about a 50% monthly engagement rate, which means the patients aren't just downloading and installing it and activating their account, but they're actually using it on a consistent basis. And so it really gives us a really strong avenue to communicate a lot of important health information with our patients. Along with that, we've deployed a virtual or AI-based virtual voice bot that has seen a lot of positive engagement and really helped us scale the way we outreach to patients. It's fantastic. Messaging is fantastic, but sometimes there are some things that make more sense to engage with voice. And so we're leveraging an AI voice bot to do that, to do things like annual wellness visit reach outs, checks on post-discharge health and well-being, and any steps that the patient needs or any assistance that they may need, and our ability to then transfer them to a live person in the event that they truly need some help. And last but not least, as part of that omni-channel strategy, it's really bi-directional messaging. We're clearly a texting kind of society. And so we've continued to use that, and that's really resulted in a significant reduction in no-show rates for things like appointments, because when a patient does have to reschedule, instead of just canceling, we give them the option in the moment to take action and to actually reschedule. So it's been really positive. We've seen some really good results.
That's great to hear. And it seems like a very convenient way to connect with patients. Obviously, keep them in charge of their journey and really empower them to further what they're doing. And, I'm curious, were they pretty easy to adopt these tools, or were there things that you had to do or ways that you engaged with the broader patient population in order to get the type of adoption that you're talking about?
No, we really doubled down on our communication strategy. So when we made our transition to Epic, we actually deployed what we call digital concierge to our practices and to our hospitals to actually be there. We had them in identifiable vests to where while they were waiting in the waiting room or waiting for their appointment, we actually guided them on downloading the app, installing it, and setting their accounts up and activating their accounts. And so I really felt like that was a big, great, or a significant lift for us, and it really kind of got the momentum. But I think it also helped our staff to understand, and they started to see the importance of the fact that, hey, this is a communication channel that the patients can use to help manage their health outside of just purely calling in all the time to the practices. So that also helped because then our staff started suggesting and recommending to patients as part of their appointment process that, hey, while you're at it, see your results, be able to do your scheduling online on your own by leveraging our app. So really positive.
That's great to hear. And what a great idea just to get the ball rolling with some of those folks that you can send out to the practices and then have them be the advocates and champions of that from that point on. Now, looking ahead in the next 12 months or so, how are you planning to build on that success? What do you expect to change about, what you're doing and how your teams are?
Yeah, I don't know if there's anything we change. I think we just really build on the success we've seen, right? So we really track the engagement metrics and how folks are actually engaging on those different channels and making tweaks along the way. We're also looking at how we can really enrich that content and make sure that we can not only just give them information, but also allow them to take action. So if it's a reminder about an appointment coming up or a reminder about a wellness visit that perhaps needs to take place, not just telling them that, but also give them the avenue in the moment to actually take action there. So we're continuing to look to ways to refine that. Obviously, like anything else, I'd be remiss if I didn't introduce the AI topic. And so, where can we then layer in AI to actually be more engaging with the patient and able to take steps along the way and guide the conversation as opposed to it being more of a fixed dialogue, which is, in many cases happens today. So, we're really looking at how we can adopt those things, especially in the next year or so. So, we really see this and we really want to build on the success we've seen with this and the way our patients are engaging on these platforms because we see it as a foundational component in our transition to value-based care. So if we can remind patients on the steps that they need to take to manage a chronic condition, it gives us a better chance of keeping them out of more costly care and also hopefully will improve outcomes over time. It also obviously reduces administrative burden when you consider the amount of time it takes for a medical assistant or a nurse to actually find the phone number, make the call, typically leave a voicemail. That can take somewhere between 5 to 8 minutes per call. And if we can leverage some of these digital capabilities to do that, then that significantly reduces the administrative burden and makes them available for the more escalated or the more critical needs that a patient might have. So, and ultimately, it just allows us to scale at the end of the day. So it allows us to do much broader outreach and to focus not just on managing, again, those chronic conditions, but managing broader health and wellness overall.
That's helpful to understand and really important to see the benefits of, bringing this technology in, not only from how the patients are interacting with their care, but then, as you mentioned, what the administrative burden it can take off of the team. And when you're looking at the those benefits clear, across the board, but then when you are trying to measure, the outcomes of this or measure whether the projects are successful or not, how do you do that? What does that really look like, especially on the patient engagement side? In no, you
Are you there, Laura?
needs to have that type of. I think it must have been like a or. Let's see here.
Laura, you froze for probably about 30 seconds or
Oh,
so.
there you are. I think. Are you back?
Yeah,
Okay. Yeah. Yeah. My apologies. Am I back now?
yeah, you're back now.
Okay. Okay, good. Yes, I think we must have had a moment of low bandwidth, so of course we'll cut this out and get back to the conversation. But
All right.
I think I'll just try to ask my follow-up question really quick one more time. But how do you measure the success of these types of projects or initiatives? What's meaningful for the organization and especially the business office when you're looking at bringing new capabilities and technologies into especially the patient care journey?
Yeah, it's a great question. We definitely tried to identify what are those KPIs that are important, and some of those are just literally are how are we seeing patients engage, right? Because that's kind of a first step for us to determine is this a channel that they will actually engage in, and how are they engaging? We'll also look at longer term. We'd obviously look to see outcomes improve over time, especially clinical outcomes. Sometimes those things take time. So in many cases, we'll start with just, hey, are we seeing a reduction in administrative burden? So as I mentioned before, if we take a look at a nurse would typically spend 5 to 8 minutes on this particular call, if that time is then saved, and we actually look to calculate that, what is that time saved when you figure the cost of that particular person and their role and the opportunity cost where they could be doing other things that would be more top of license for them as opposed to just making an administrative call to them. So there's a variety of KPIs we tend to look at, but we are very purposeful, very purposeful in how we look at those KPIs to ensure that those strategies that we're engaging actually provide value to the organization and ultimately provide value to the patient.
That's helpful to understand. Thank you for digging deeper into that space. Now, before to do you think possible because of the in health care? Am I back? All right, sorry about that. Am I back?
Yeah, you're back.
Okay, okay. Last question. So my
Okay,
apologies. Hopefully I could make
no
it through.
worries.
All right. Now, I wanted to look into the future as well. What do you think will be possible in the next 3 to 5 years or so that isn't today because of technology?
Yeah, this is where I think, again, there's a lot of buzz around what artificial intelligence can do, but I think even what we're seeing today, but if I take a look at the future, first of all, 3 to 5 years out feels like an eternity, especially given the advances that we continually see in this space. But I think, AI is going to be, I really feel strongly it's going to be front and center. Probably if I take a look at three key areas from my perspective, one is I think AI will continue to get better in really helping providers and clinicians synthesize the vast amounts of data that are available about a patient. There's just so much that's available about us, whether it's test results, whether it's labs, whether it's just, appointment details or whatever. All these different things aggregate together to give a profile of a patient, but it's really hard as humans for us to synthesize all of that to make sense of it. But more importantly, to identify that particular thing that says that's an indicator we need to go dig into. So I really think these technologies are going to give our providers and clinicians insights that we've never had before so that they can develop very personalized and very prescriptive care plans for us and hopefully, ideally, getting in front of potentially, major conditions, right? That we can identify early and treat early. I honestly think too, and this is one that's been a little controversial, but I think some of these technologies are really going to change the way our clinical teams engage with our EHR. I still see the EHR as a source of record across the board, but if you take a look at just what's happening in the ambient listening space today and how that's shifting the way a provider is able to engage with the patient, but also appropriately chart and code an encounter, I think there's going to be huge shifts over, especially the next 3 to 5 years, in the way what that interface looks like. It may be less about a keyboard and much more about voice and how that voice and that input is then appropriately instrumented within the EHR. So, and ultimately, what we're thinking about is how can I build a digital health companion over time to where it's a companion that knows about me. It gives me insights, it gives me recommendations, it gives me prompts and nudges of things I need to do. Maybe it's time to go out for a walk because it looks and sees that the weather's great, and it wouldn't hurt for me to get my 10,000 steps in today. And so it can engage with me on a daily basis, but also keep my care team informed and watch for trends and alert them. So I think there's a huge opportunity for these things to come together with all the data that we have, uh, and really, building a companion, if you will, that will help us manage our health each and every day.
I love that. A digital health companion, it seems like the perfect way to, kind of step up that healthcare journey. And as you said, get you patients to the place where they're really seamlessly integrating a lot of what they need for their health into their daily lifestyle. Thank you so much, Eric, for joining us on this spotlight today. This has been a lot of fun, and I'm looking forward to continuing this conversation at our Health IT Digital Health and Revenue Cycle event coming up in the fall. I'm just excited to have you there and be speaking, and truly, it'll be a special and fun event. So thank you so much for your time today, and looking forward to the fall.
Thanks, Laura. Looking forward to the event as well. Thank you.